Benham Medical Center, coming live today. We'll continue with our talk. The talk that we'll have today is common signs of parameters like BP, the one that we continued with. We had started CKD yesterday. Okay, so let's see. Let us see. Let us see what is happening. Okay. Let us see the topic of the day. It is important to check the topic of the day. Yes. Let us see the topic of the day. What is the topic of the day? Common parameters. What are parameters? What are parameters? It's very important to note that. What are parameters? And, if you are logging in right now, we are going to talk about common parameters. We had talked about CKD in partial, but that's a big topic. We will get a day where we will discuss the chronic kidney failure. But today we are still continuing with parameters that we left on at hand, and you know it's a weekend, so it's a random thing. If you have any question on this weekend, you are welcome to ask. If you have anything that you wanna ask, you are welcome to ask. The parameters usually are taken from for emergency medicine, you understand, from the emergency center, emergency area, and some people take parameters from inside the hospital. But we have mostly reception. There are some receptions that are big, some receptions are small. So if you're coming in now, it's better the chat is open. You can ask your question. You can ask anything that you need to ask as usual. So let's get to work. The last time we had talked about blood glucose, oxygen, blood pressure, respiratory rate, pulse rate, and temperatures. And you remember what we talked about? We talked about the normal vital signs that we should be careful of. Temperature, which entails normal fever and low temperatures and normal temperatures. We talked about the pulse rate. We talked about normal pulse rate, which is 60 to 100 beats. We talked about tachycardia and bradycardia. So we talked about the respiratory rate. We talked about We talked about tachypnea and the others that we talked about. So we will continue with that. We want to finish that because we have some other things to do that are pending. So many things are pending and we should take care of them. So check out, if you have any question that is left, you can ask today. You know, here it's a weekend, it's 4:35. we come from different states, and we may have different time zones, and when you have different time zones, sometimes it's hard to know. A minute. I want to send a link somewhere. So as we continue, let's wait for the people to come. Let me give like 2 minutes for some people. I can see Onik has arrived. Onik, welcome to the platform. Onik, today we are dealing with normal things, but some of these vital signs, welcome Onik, are taken from the outpatient department. Some of these are taken from the outpatient department, and when they are taken from the outpatient department, it gives people an overview or a way on how someone can manage a patient quickly. There are some emergencies that take from the reception. Like today, I'll take you, and sometimes it's good to be practical, and I will take you through something that you have to do at the hospital, and you're taking vital signs. So I'll walk you through practicals. Don't forget, yes, Onik, don't forget to do that. I'll walk you through some issues that are very important. So let's go to the reception. I want to take something because there are some practicalities you can do. I want you to see the reception first before we check. There are some receptions that are big, others are small, like the ones that you are using. You see, let me check here. It is a confined area. And vitals that you are taking at a confined area like here, at a confined area like this, you should be checking. This is our small reception, a small reception, and a person has come to hospital with a raised BP, or the fevers are high. You see, this is a glass, so you have to aerate this person. The first thing, you do physical analysis. Even if it is you who has taken a person to a hospital or anywhere else, the first thing you do physical analysis. You check at the person. Look at the person the way he is first. Is this person sweating? If the person is sweating, because this is a confined area and you see these are glass, you should aerate. Even if the medical personnel is not there, the first thing you should do is to aerate by opening, so that this person can get some fresh air. The things you should do here is like, this is a reception. Today I'm coming live from the reception of Bernhard Medical Center, and you can see that is the logo there. J. King, welcome. Tips on how to manage. You have gone to a hospital. The reception is not big. The first thing you should do at a particular place like this is to make the person comfortable, so that you can take the vitals in a good way. We are continuing with our talk on aeration and normal vitals that we should take, like pressure and temperature. Look at the person that you are having. Is that person having headaches? Is that person... Hello, doctor. Happy Saturday, everyone. Quincy, welcome. Today I'm coming live from the reception. I've started my live from reception. This is the logo of the reception. You shout. You go to a person at the hospital, is confined, is not responding. You should shout. You should shout. Let the people know that there is a problem, because you can come at the reception like this, and you see the receptionist is not there. Look, the receptionist is not there. So what do? You should shout and seek for help, so that the health personnel can come. There are some things that are so important when it comes to vital signs. Vital signs, what they do, they give the doctor an overview of how to work out or how to manage that person faster, so that this person cannot lose life. Yes, it's very important. We had talked about blood pressure. Here we have a seat This seat it can be used as several things. If someone has come, the person first sits here. Sitting here means you should do random blood sugars. Second, you should take a BP. BP is very important. These are things that are used in emergency. I know these things you know, and I want you to help me name them. One is sugars, blood pressure, and there is you check on the respiratory rate. You know, respiratory rate helps the doctor to know how this person is responding. You check at the environs. If this person has sat at this chair, the reception chair like that one, are there any sputums there? And how do those sputums look like? So we go back to the lecture. That one I will be relating to that reception that is there, and it's very important. You will not see anyone because of confidentiality. So let me go back to, you've seen the reception, and there's some things I'll talk about the reception. So vital signs checkup. There are some checkup of vital signs that are for emergency, and there are some vital signs that are not for emergency. Some of the vital signs are for normal checkup. So we were talking about normal checkup of vital signs, but let's go again. We started by temperature. Those ones are taken at the reception. One, if you see the temperature is so high, definitely you know the person has what? Infection. One, just it rings to your mind this is an infection, and it gives you a time period as to when the infection might have started. It depends with the temperature. We said above 38 degrees, that is very high temperature. Yes, I can see people are here. Welcome, Uncle Queen NLB. We can see Judy in the house. Judy is here. I was giving some time so that we can start, but I see several of us are here. So we continue. Let me see, where is this now? Sometimes you check for some things and then they get lost. Let me get to this. So we talked about vital signs. So those signs can be taken normally when you are taking some parameters, or those signs can be taken when there is an emergency. So we have talked about temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. And also we talked about full hemogram. So normal blood tests, the complete blood count, CBC, full hemogram. How does it help us to understand someone? How does it help us to understand there is a problem? The full hemogram. I know most of you have done that full hemogram, and you didn't understand. I will repeat about the full hemogram because it's a very important thing when it comes to normal vitals of your body. You know, it takes an overview of whatever that you have in your body. Onyx, welcome. We can see you in details. Janet Hayes, welcome. I've seen you. A complete blood count is the most common laboratory used. That is most commonly used, and it detects several things like infection, anemia, immune disorders, and many things. So if you have ever done that complete blood count and you're here, please tell me, did you understand, or the doctor just told you we want to do a full hemogram? It's important to know what you are doing and what you are dealing with. So full hemogram, what is a full hemogram? A full hemogram is a laboratory test where you take your blood and then it is run to see some parameters, and these parameters are like red blood cells. Another one is like red blood cells indices. This help to clarify some to differentiate some anemias. So you will see something like HB levels, leukocyte levels, you see. So when they do it in the laboratory and the results come out, we check on red blood cells count. How many number of the red blood cells per a slide or per millimeter squared? How many do you have? Are they normal? Hemoglobin, HB, oxygen carrying protein, is it normal? Hematocrit. Hematocrit means percentage of blood made of red blood cells. That is hematocrit. I can see people are still coming in. The lecture is still on and new. So if you're coming in, let's know if you are new in the platform. So just text in the chat. Let's know you are new in the platform. But I can see Onyx. I can see Janet Hayes. I can see Jamaican Uncle. I can see Judy. I can see Queen is in the house. Now let's continue. When you see hematocrit, you know, it means percentage of blood made of red blood cells. Normal approximation, your HB for males must be 13 to 17. HBs for female must be around 12 to 15. That is a normal parameter. So hematocrit levels, we have said, is percentage of blood made of red blood cells. The percentage of blood made of red blood cells is the hematocrit. So you will see 40 to 50% in women, and females are 36 to 44%. And then we have some things here like red blood cells indices. These ones are classified as types of anemias. They are classified as types of anemias. And yes, please that's the money. These are classified as indices are very important, and they are classified as anemias. You help to classify anemias. They help to classify some anemias. You know, there are different types of anemias. You can get anemia because your red blood cells are big. You can classify anemias because your red blood cells are small, like in sickle cell anemia. You can classify anemias because sickle cell, you know, they have small cells that are main. Yes, Dorothy, I can see you. Hi, welcome to the talk. As we continue, you see, MCV. I know when you looked at that full hemogram, you saw something like MCV, mean capsular volume. It was showing size of red blood cells. When the size of red blood cells are low, it shows microcytic anemia. Microcytic anemia means the red blood cells are small. The red blood cells are small and they cannot carry oxygen as needed. That is called micro. Normocytic anemia. Normocytic anemia means, I'm going through the full hemogram, but going deep to different things. Normocytic anemia means that you have some normal red blood cells, but they are not enough to carry oxygen that is needed. You get? And then we have macrocytic anemia, e.g., when you don't eat a lot of greens and then you have vitamin B12 deficiency, you get big cells, but they are not healthy. They cannot carry anything. They cannot carry enough oxygen. This is called macrocytic anemia. And then you have something that is called, there is something that is very important that is called mean capsular hemoglobin, amount of HB per cell. How much hemoglobin do you have in a cell? Because you can have a cell, that is let me say you have a cell, you have hemoglobin, they are carrying oxygen, but you don't have enough HB. You know, HB, hemoglobin, is that binds to oxygen and then it is transported through your body. So if you don't have you have the cells, but they don't have enough hemoglobin, you will not have enough binding capacity to the cell. You get? These are things that you will see doctors looking and asking for this full hemogram. You see, a mean capsular volume means the Explorer. I am back. Hi, the Explorer. Nice. I can see you are liking the chat, and continue liking. Give the likes. Yes. The lecture and the talk is so nice. So the Explorer is here. The amount of HB per cell. How much hemoglobin do you have in one cell that can carry oxygen to your body? It's very important. Something else that is called mean capsular hemoglobin concentration. Concentration of hemoglobin in one cell. You know, you can have normal cells, but they are not having hemoglobin, so they are not carrying enough oxygen, because hemoglobin is the factor which binds to oxygen, which is very important. I have 16 units. Yes, that one you are okay. The Explorer, you are nice. That one, 16 units is okay, but that is hemoglobin. 16 units is okay. We have low, which is hypochromic. Hypochromic is when you see someone, you look at the hands and then you look at the eyes. This person doesn't have the red coloration. It means that this person is hypochromic. The cells doesn't have enough hemoglobin, and when your cells doesn't have enough hemoglobin, you become anemic. It is not just because you have lost blood or you have sickle cell. You see, they are different. You can have normal blood cells, red blood cells, but they don't have the capacity of carrying oxygen because the hemoglobin in it is depleted or is low hypochromic cells. And then we have something called red cell distribution width. How many variation in red blood cell size? How many do you have? You see, so if you are coming to now, you are a new person here, we talk about medical issues and discuss. You can hit the like button, subscribe. If you are on YouTube, if we eat more iron, then do it improve? Yes, iron improves. That is from the Explorer. Iron improves red blood cells, because without iron, you will not have hemoglobin, or it will be low. So that is one factor that can improve, but it depends, because there are some conditions that if you even if you eat or you use iron to boost, you still have a problem. And this one is when it comes to genetic problems that are like sickle cell disease. You know, it's transferable. So when you use a lot of iron and you have genetic complications, you need to be treated first before you boost. And then we have Majay. Hello Majay. I can see you waving your hand. Welcome Majay. As we continue, if you have a question, please drop it in the chat. Let's continue. So the Explorer, it is very okay when you are using iron. It is very okay when you are using iron, but it depends with the kind of anemia that you are dealing with. You get red cell distribution width. High is equals to mixed sizes. High is equals to mixed sizes. Variation in red blood cell distribution, it can be a problem. Now let's go to white blood cells. White blood cells, I will say this. We have, I'm repeating because I want people to understand about the full hemogram, because when people go to the hospital and the full hemogram is done, they will only be done, they only say I was blood and it's okay. No, it is a capacity of several things. Let's talk about white blood cells. White blood cells are made of lymphocytes. There is basophils, mesophils, and neutrophils. You guess? Basophils, mesophils, and neutrophils. So there is this lymphocyte. There is this type of white blood cell that is called lymphocyte, that is divided into 3 natural killer cells, and there is one that is called, after natural killer cells, we have another that is called T lymphocytes, and B lymphocytes. Now, T lymphocytes and B lymphocytes, their work is for defense. Natural killer cells is to destroy and remove. So when you eat something and you get allergies, T lymphocyte is the one which activates the allergies. You get, and B lymphocyte. So my friends, you don't just say I was checked my blood in a hospital and I was told it is okay. No, you see, these are the things that we check and then we know what is happening. So white blood cells, let's go to white blood cells. We start with the lymphocytes. The lymphocytes are neutrophils. Let's start with the neutrophils. First responders to bacterial infection. In increase, if they are increased, we know that there is a problem and this person is undergoing what? Is undergoing an infection. Lymphocytes, important in viral infections and immunity. They are important in viral infections and immunity. Increase in viral infection, e.g. TB and HIV. And we have said lymphocytes, we have basophils, eosinophils, monocytes, you get it, and those are the divisions of lymphocytes. So basophils are for allergic reactions, that's what I've said, involved in allergies. Eosinophils, they are involved in allergies and parasitic infections like asthma and worms. Sometimes you can have worms like Trichuria tuturaris in your stomach, and then you see your skin is having some allergies. It is the work of eosinophil. So the allergy that you are having in your skin is not because of the skin problem, but it's because of the allergic reaction of your cells, the white blood cell that is called eosinophil. That's why people will say, I think I'm having some worms in my stomach. Look at my skin. It is because the eosinophils cause adverse reaction when they are fighting. So you will see a reaction on your skin. It's not your skin is bad, but the stomach has a problem. We have something called the monocytes. Monocytes are clean up dead cells, like natural killer cells. Macrophages clean up dead cells and they remove to the blood. They are called the monocytes. So those are the works of the white blood cells. And there is a white blood cell that is called the neutrophil. Neutrophil, when one is having an infection, it's the first responder. It is the one which awakes all the white blood cells to start work. Even the basophils release histamine. This is why sometimes when you are sneezing and having some problem, some people say that go and bring me the antihistamine. Go and bring me the antihistamine. It is because when you sneeze so much, you can have a headache. And when you get a headache, BP can rise. So you take an antihistamine, and antihistamine stops basophils from releasing histamine that make you sneeze or get some allergic reaction or like swelling. You get, that's why you take cetirizine. Cetirizine suppress the stop basophils from coming out. And how are they distributed? Basophils in your normal person is like 1% in blood. Eosinophils 1, 2, 3, 4, and then we have lymphocytes are many. Those are 20 to 40%. And then we have neutrophils. Neutrophils are 40 to 70%. Just imagine, 40 to 70%. So we continue, my friend. You see, white blood cells are made up in your blood. White blood cells are like 4,000 to 11,000 cells per microliter. Imagine. So your blood is made up of many white blood cells, not even like red blood cells. You get? And it is very important to note that the red blood cells, we have red blood cells, but the other, like the ones we check, like mean capsular volume, MCH, mean capsular volume, mean capsular hemoglobin, all of those, what we check is just the indices. Because if the red blood cell is small, we will know. If the red blood cell is small, we will know that we are dealing with this particular disease. Because if you have small red blood cells, That one can tell us, oh, this one is fighting a genetic thing. The cells that are being produced from the bone marrow are not okay. So what do? We have to give this person a genetic makeover, like monoclonal antibodies to help, or we start to treat the problem that is in the. Sorry about that. We start to treat what is ailing this person. So my friends, when it comes to the full hemogram, people just say that I went to a hospital and I was done. This doctor, this is what people say out here. This doctor is very funny. I went to a hospital and he just did one test and he told me so many things. It's because you are seeing one test with some parameters, but as we are seeing several things that are deeper in it, and we can explain so many things so that they can guide us to what problem you are undergoing. So we check at the full hemogram, and we have said when we check at the red blood cells, what we are seeing is mean capillary volume. The size of the red blood cell can tell us a lot. We have said it can tell us if you have small red blood cell, it means you are suffering from like genetic diseases like sickle cell. If you are normal, you have normal red blood cells and your cells are low, it means you are losing blood either through a wound or internal bleeding. And then we have high, which is macro. We will know macro means you are having big red blood cells. This one will tell us that maybe you have a deficiency on vitamin B complex. And when you have a deficiency on vitamin B complex, what do? We give you a supplement. You know, there are some people get anemia because of nutrition, or the enzymes that are used to break down the whatever that you are lacking is not in your system. So we give it to your system for you to be normal. And then MC, mean capsular volume, amount of HB per cell. Red blood cell is there, but we check amount of hemoglobin in your cell. How much hemoglobin do you have in your cell? How much? Because you have a red blood cell, but what carries the oxygen is the hemoglobin. So how much do you have? You see, that is a different type of anemia you can have, because if you don't, the cells are normal but hemoglobin is low, it means you have a different type of anemia. And then mean capsular hemoglobin concentration of HB in red blood cell. You see how we check, and we know we diagnose, how we go deep, we diagnose in why do you have anemia. Red cell distribution within an area. How many red cells do you have within an area? It is always giving us, and you will see that one will give us like hematocrit, ferritin. There are some like things like ferritin levels we will check. And we have talked about white blood cells. Now, there is something else in a full hemogram that you need to know, like platelets. Platelets are for clotting factors. If you cut yourself and you have low platelets, you will bleed a lot. So we check it so that we can see malignancy or problems that you have in your body that can lead to you to have some problems that are genetic. So platelets are so many in your body so that they can protect you from bleeding when you cut somewhere, but they are not active in the body. There is some processes that go through your body when you cut yourself, because if they are active in your body, you will get clots. There is something that is called heparin. There is something that is called heparin that is in your body, that we check to see if you have a problem. There is something that is called von Willebrand factor that is activated when you are cut, so that the platelets can be active. So you know they stick where you have cut, so that you cannot bleed. You get? They are the ones which help you to one day we will talk about how the activation process takes place and how it gets to stabilize your bleeding so that you cannot bleed. So platelets are like 150,000 to 400,000. 150,000 to 400,000. Low platelets count is called thrombocytopenia. High platelets count is called thrombocytosis. Thrombocytosis is whereby you have platelets that are very high and you have a risk of clotting inside your body. So people that have clots in the venous system or arteries inside, we check on this if this person has thrombocytosis. Peripheral blood film is a very important thing that we usually check. When sometimes you can go to a hospital and then they prick you, they take a slide, a small blood size. What this is, they go and see is the shape, the size of variation, and abnormal cells. This is called peripheral blood film. Mostly, it is used to diagnose sickle cells. Sickle cells, e.g., blasts in leukemias. Mostly this is a very important test when it comes to leukemias. You know, how do we use clinical? If you have a question, don't fail to ask. It's a weekend. You know, people don't want to study so more when it's a weekend. People want short sessions and then they do their thing. So, clinical uses of complete blood count. Anyone with a question? Today we will have a short session. Okay, no question. We continue. We had talked about blood glucose, kidney function. Kidney function is an important test. Yesterday we talked about chronic kidney injury, and you saw chronic kidney injury is where the kidney is not functioning well because at the nephrons, the pores are not filtering blood as needed. So how do we do this test? In creatinine, in the kidney, there is something called creatinine. If it is not filtered well in the system, what happens? What happens is you cannot balance. It makes your BP go up. You get? So we check it so that if it is not filtered well, we know there is a problem with your kidneys. And in men, it's supposed to be like 0.7 to 1.3. In women, it is supposed to be like 0.6 to 1.1. You get? So urea is a normal thing. Everyone knows urea, and it can be like 7 to 20 milligrams per deciliter. Urea, and then let's see the I am Chris. Welcome to the chat. Hope your subscription is there, and liked. I see I'm Chris in the channel. Let's see about what are the clinical uses of complete blood count. What are the clinical uses of complete blood count? One is to detect iron deficiency. You detect iron deficiency. Second is to check vitamin B12 deficiency and chronic disease anemia. And then the other one, anyone who has a question, because I'm already ending, I'll come with another session from 8:30 at night, another session because I have to do some things. So if you have a question, you can ask, but you know we have another session at 8:30 at night at Kenyan time, which will be at night. In the US, I think it will be midday. Yes. Diagnosed infections like bacterial infections and viral infections, and then we have detect blood disorders like leukemia, bone marrow, and failure, bone marrow failure. We have something else, and assess bleeding and clotting issues. To assess bleeding and clotting issues, monitor disease and treatment like chemotherapy, and can kidney stones dissolve by medication? Medications that can help that, but most of the kidney stones don't dissolve MAGE-B. What they are done, if they cannot come out, what we do is we do surgery. We do surgery, because if we leave them there, they will become big and they will injure your kidney. There are some drugs that we give, and they because you know a stone is a stone. There are some drugs we give and they dissolve, like but you know it depends with the type of stones. There is medication like allopurinol that are made to reduce uric acid. If it is a stone made of uric acid and calcium problems, it can dissolve, but it takes time. Some people end up just doing what? Going for surgery if it's a big stone. If it's a big stone. Potassium citrate, they are used. There is something called sodium bicarbonate, allopurinol for uric acid. So it depends with the type of stone that you have. We talked about stones. I will talk about kidney stones at the 8:30 lecture that we will have. So I think I've answered that, Maje. My grandmother has one. Okay. How? Check the size. Go and do the ultrasound. Let it be measured, and then you can be advised if you can be given drugs, or it can. Some of them even come out by their arm. Me, I'm sweating a lot. Check your T3. Sweating a lot, go and check thyroid function, T3 levels. And if it is sweating and it's not giving you problems, why worry and it's not giving you problems? I think you just live with it, because sweating is good. It removes toxins from your body. Again, we have monitor disease treatment. Some when we this full hemogram, I think I have answered those two questions. The full hemogram. Anyone with any question, by the way? So I am Chris. If you are sweating a lot, it means you have high levels of T3, thyroid hormone that is called T3. Sometimes it's not bad, it's good. And me, even in winter, I sweat, yet it's very cold. Yes, you check your T3, but if it is not being pathologic, there is no need to worry. Don't worry. Just live with it. You see. So, Maje, do a full hemogram, check the size, and if it is bigger, please remove it surgically. If it is small, advise your grandfather to take a lot of water, so that it can pass by itself. Sometimes they pass just down by itself, and then you are okay. Well, let's check on assessing bleeding. A full hemogram can be used to assess bleeding. It can be used to assess bleeding, because some people just bleed. When you brush your mouth, you bleed. I will check it when I'm back in Uganda, because right now I'm still abroad. Very, very important. Very important. But you can check it even when you are in abroad. Just walk to a hospital, talk to a doctor, and tell the doctor that I want to do it, or a laboratory. So a full hemogram can be used to assess medication as a person is sick. You continue checking if this person is improving or not, and then we have assess bleeding. There are some people who have problems with bleeding, so we continually check the bleeding. Welcome, I'm Chris. You continually check the full hemogram, so that we can see if this person is improving. And you know, some bleedings are genetic, like disseminated intravascular coagulation. It's a bleeding you can bleed. That is, when it is activated, it can cause death. So when you check the person, or maybe he has a cancer, a particular cancer, you can check the bleeding through all this. You get? And things like leukemia and bone marrow failure, we can check them even through the full hemogram. You have seen how we check it through the full hemogram. It's very important. We have seen we can diagnose infections and viral infections. High lymphocytes it tells us that you have an infection, and then we have high white blood cells also shows that you have bacterial infections and viral infections by high lymphocytes. These are things that you can check on your full hemogram, you get? And you can detect anemia through that, you get? Very important, it's very important. So okay, if 20 anyone who has a question or something, but we will meet at night for another short session. We'll check our progress, because we have to talk about other things that are very important, like kidney function tests. We can talk about there are some parameters that we have not talked about them. Kidney function tests, we have not talked about them. Those are very important. We have not talked about electrolytes in the kidneys, like sodium, potassium, calcium. Those are very important. Sodium, that when you take something in the stomach, sodium helps to carry glucose in your blood. Those are things we should talk about. Potassium, how it protects the heart. Calcium, how it makes your veins constrict and relax. Those are things we should talk about it. So this is like we have let's go to 50 minutes. Anyone with any question? Onik, you are there? Anyone with any question or can say anything? It's a weekend and it's a short session. You check. I'll come back at 8:30 or 9. I talk about the remaining things. 8:30 or 9. So I see today people have learned shortly, and let's meet at 8:30 for another short session if it will be possible. So wherever you are, everyone, have a lovely day and a lovely evening. We meet at that time. Bye bye.